Todd Moore,
Here.
Dan Ward,
Here.
Jerry Heidenreich,
Here.
David Cash,
Here.
and Christopher Ambergy.
Present.
You have quorum.
Thank you. If you would, please stand for the Pledge of Allegiance.
And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, next on our agenda tonight is our minutes from September 7th. Hopefully everyone's had a chance to review the minutes. Any questions or revisions?
I move that they be accepted as presented.
Okay, do we have a second?
Christopher Ambergy,
Abstain.
David Cash,
Yes.
Jerry Heidenreich,
Yes.
Dan Ward,
Yes.
Todd Moore,
Yes.
Jim Hall.
Abstain.
All right, that brings us to our first case this evening, case number 1622, a request by applicant Mark McClure for an appeal to the Board of Zoning Appeals for the property located at 2 South Main Street. Property is zoned UC Urban Core Central Subdistrict, and the request is to appeal the Zoning Code Administrator's decision that an office for a human and animal chiropractor is considered a medical office, a veterinarian office, and/or animal grooming, where the City of Middletown's Development Code prohibits medical offices, veterinary offices, and animal grooming in the UC zoning district. I believe we need to swear in Mr. Metz to get started.
Do you solemnly swear that the testimony you're about to give before this board will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
Thank you, Todd. So tonight we have variance case number 16-22, a request by applicant Mark McClure for an appeal to the Board of Zoning Appeals for the property located at 2nd South Main Street. The property is zoned UCC Urban Core Central Subdistrict. The purpose of the UCC subdistrict is to encourage, support, and enhance downtown Middletown as a mixed-use, high-intensity urban district and a center of retail, service, entertainment, office, government, and urban residents. The UCC subdistrict encourages pedestrian-oriented retail or eating, drinking, and entertainment establishments on the ground floor and residential and upper floors of buildings, but also allows service, office, institutional, and recreational uses. As you can see, right where the arrow is pointing is 2nd South Main. The Middletown Development Code, Chapter 1204.08, permitted principal uses. Table 1204-3 states medical or dental offices, clinics, and 24-hour urgent care and veterinary offices and/or animal grooming is not permitted uses within the UCC subdistricts. The Middletown Development Code, Chapter 1230 definition states medical offices and dental clinics, 24-hour urgent care is considered office or clinic uses concerned with the diagnosis, treatment, and care of human beings related to medicine or dental. This term shall also include the operation of an urgent care clinic that may be open for 24 hours and that is meant to accommodate non-emergency medical situations. This definition does not include hospitals, skilled nursing facilities, or personal care facilities. Such uses may include accessory services such as laboratories or pharmacies for the use of patients while visiting medical practitioners in the clinic. Veterinary offices or animal grooming, a place where animals or pets are given medical or surgical treatment and are cared for during the time of such treatment. Use as a kennel shall be limited to short-time boarding of animals being treated at the facility. This use type shall also include establishments where the primary service provided is the cleaning and grooming of domestic pets, including bathing, brushing, combing, nailing, and hair trimming, and where there is no boarding facilities. Once again, these uses are not permitted within the UCC. A chiropractor, definitions, several different definitions. The Oxford Dictionary states a practitioner of the system of integrative medicine based on the diagnosis and manipulative treatment of misalignments of the joints. Merriam-Webster Dictionary states a licensed healthcare professional who treats disorders such as back and neck pain, chiefly of the muscular skeletal system, especially through the manual adjustment or manipulation of the spinal vertebrae to correct nervous system dysfunction. Ohio laws and administrative rules states a chiropractor is authorized to examine, diagnose, and assume responsibility for the care of patients, any or all of which is included in the practice of chiropractic. Ohio Revised Code 473401 states, as used in this chapter, the practice of chiropractic means utilization of the relationship between the muscular skeletal structures of the body, the spinal column, and the nervous system in the restoration and maintenance of health in connection with which patient care is conducted with due regard for first aid, hygienic, nutritional, and rehabilitative procedures in the specific vertebral adjustments and manipulation of the articulations and adjacent tissues of the body. We received an application prior to July 28, 2022. The application was denied on July 28th. The notice letter was delivered on August 2nd of the denial of the Certificate of Zoning Compliance, and the appeal to the Board of Zoning Appeals was submitted on August 22nd of 2022. The Middletown Development Code, Chapter 1204.08, permitted principal uses prohibits medical or dental clinics, medical offices, and 24-hour urgent care. Just a little bit of history on this. I know we dealt with a project like this back in February, but just as a reminder, on May 7th, 2021, the City Council placed a 6-month moratorium on the acceptance of development-related applications and the issuance of any permit or other approval regarding the development or redevelopment of real estate for the purpose of skilled nursing or personal care facilities, medical clinics, pharmacies, urgent care facilities, or similar uses within the UCC and UCS subdistricts. During this moratorium, City Council and City staff reviewed the Middletown Development Code and approved a text amendment prohibiting these uses within the urban core districts. The text amendment ordinance number 2021-73 was approved and became effective on October 22nd, 2021. Additionally, here's the ordinance number and the highlighted section showing Exhibit A was the text amendment. Per the Middletown Development Code, the requirement for legal notice for appeals, requests, and meeting notice letters for the proposed appeal were sent to all property owners contiguous and directly across the street or public right-of-way, and no comments were received. Chapter 1226.13 appeals. Per the Middletown Development Code, this section sets out the procedure to follow when a person claims to have been aggrieved or affected by an administrative decision made in the administration or enforcement of this code. As you guys may have noticed, this is not a variance. This is an appeal to the Board of Zoning Appeals regarding a decision made by the Development Code Administrator. I guess in layman's terms, this is I made a decision regarding what type of use the chiropractic office was. I said it was medical. There is a disagreement that chiropractic work is medical, which is why they're appealing to the Board of Zoning Appeals for you guys to decide, essentially, if that is the case or not. I'm going to read the review criteria, and then I also have our law director, or assistant law director to kind of help us through the process, as this is something that we don't typically deal with. We deal with variances, primarily area and dimensional. So the criteria that you will be reviewing this appeal on is described as: a decision or determination shall not be reversed or modified unless there is competent material and substantial evidence in the record that the decision or determination fails to comply with either the procedural or substantive requirements of this code. If you were to feel that the decision by the Development Code Administrator needs to be overturned, I believe you would be administering a stay, which is described as: a properly submitted appeal shall stay all administrative proceedings by the city in furtherance of the action appealed, unless the Development Code Administrator certifies to the BZA that a stay would cause imminent peril to life or property, in which case the administrative proceedings shall not be stayed unless a restraining order is granted by the BZA or a court of competent jurisdiction for a good cause shown.
Just to be clear, that stay is in effect right now. What that's saying is that while we're waiting for you all to make a decision, staff won't take any more action with respect to the property or the use.
Thank you. That's why he's here. And I'll pass it over to him in a second after I kind of give a short little rundown of the history. So, an appeal. Any person or entity claiming to be injured or aggrieved by any final action of the Board of Zoning Appeals has the right to appeal the decision, the Court of Common Pleas, as provided in the Ohio Revised Code chapters 2505 and 2506. So, I think that kind of covers the history of it. Why we made the decision is when we got the application, it came through as essentially a chiropractic work. I consulted our legal department, consulted several other departments. It was determined by the development committee that chiropractic work would probably fall under medical use, in which case we decided to deny the application. We sent out the outcome letter, talked to the applicant, decided that they had the opportunity to appeal to the Board of Zoning Appeals, which would be you, and you're essentially deciding whether or not to overturn my decision. Austin is here. He's the assistant law director, and I believe he could probably shine a little bit better light on this situation.
There's honestly not a whole lot more light to shine. As James said, this is not a variance, even though it says it is a variance case. This is an appeal. Your process is basically going to look the same. You're going to call up anybody. You've heard Mr. Metz's testimony as to the decision that was made. You'll hear from the appellant as to what their argument is as why they believe that Mr. Metz was wrong. If they have people that they'd like to call in support of that, or if there's anybody here that you want to hear from with respect to this, you're welcome to do that. And then really the question for you is a pretty narrow one, which is, did Mr. Metz get it wrong? Is this something other than a medical office or some sort of animal care facility or some combination of the two? I will say I believe the application indicated really two uses, both of which were denied. So one of them was for chiropractic care for humans. One is chiropractic care for animals. I believe that staff analyzed those under two separate provisions on the use table. Considered the chiropractic care for humans to be medical office use, chiropractic care for animals to be either veterinarian or grooming, which are combined in our code. So that's just some background for you. If you have questions as we go along or right now, feel free to ask me. That's why I'm here. But otherwise, you guys are the appellate panel, and you're just telling us whether Mr. Metz got it right or wrong.
And before in my staff report, I just want to say one thing. We did place a stay and issued a temporary C of O for the applicant to continue operations until he could be heard by the Board of Zoning Appeals. Okay. So the applicant is here, and I end my staff report.
All right, thank you. Any questions for Mr. Metz or Law Director?
I have one question. I am assuming, and I've reviewed the various sections of the ordinance, chiropractic care was never a specific category of professions that was prohibited by the UCC, the Urban Core. The specific term chiropractic practice.
Correct. Yes, it's not listed in the development code.
Are there others not listed in the development code?
Other like subsections of medical offices?
I mean, we're citing chiropractic. I'm willing to bet that for a city or any governmental body to list all of the items, you're just not going to find it.
That's right, and that's why we have this process. So when the application comes in, Mr. Metz has to make his best decision as to what it should be classified as. And then if the applicant feels like he got it wrong, they have the ability to appeal to you.
Sure.
So we're taking the specific subset of chiropractic care and deciding what bigger bucket does that go in.
If I remember correctly, several months ago, we had the building at Canal and Central Avenue for a mental health facility. And I don't think that mental health was specifically mentioned counseling in that. I may be wrong, but I can't remember if it was in there or not.
That was from a case, Jim, back in February regarding mental health treatment and
Okay, well, at this time, I'll go ahead and open the public hearing. Anyone wishing to speak in favor, or anyone wishing to speak in favor of the appeal, please come forward. And Mr. Cash will swear you in.
Right here. Thank you, sir. Sir, do you solemnly swear that the testimony you're about to give before this board shall be the truth, the whole truth, and nothing but the truth, so help you God?
Yes, sir. I've been in Middletown for 36 years, practicing as a chiropractor. Since 1895, chiropractic has been a drug-free profession. We don't do injections, we don't prescribe medication, and we don't do surgery. So for me to claim to be a medical doctor or a medical office would be against the law. I would be arrested for practicing medicine without a license. I have my license through the State Board of Chiropractic, and I've been doing that, like I say, for 38 years. I've worked here, but I've also worked at Quantico Marine Base that recognizes chiropractic as not medical. I am not a veterinarian. I do treatment on animals, which is a residency program that is offered through the chiropractic schools. It is eligible for veterinarians or chiropractors. What I do with animals is the same thing that I do with people, and according to the state law, it is to be only hands-on spinal manipulation. So that's what I do with animals. I do not do grooming. I didn't go to school 12 years to be a dog groomer. There's no grooming in my office. So practicing in Middletown for 36 years, that's what I've done. And I would think that some of you are probably familiar. I've been on the school board. I'm on Rotary, so I'm very active in the community. My wife is a nurse at the hospital. So I've just been doing hands-on manipulation. And I don't do any insurance billing. It's a cash practice. And so I think as I looked at this, you have a massage therapist that's probably a block away from me. She is a healthcare provider that does not use medication. And if you were going to lump somebody together, I would think chiropractic and massage would probably be appropriate if you don't have a category for chiropractic. So that's all I have to say. Do you have any questions or anything you want to ask me?
How did you come to decide on this particular location?
I just came down and looked at the downtown area. There's chiropractors in different areas. I've been on Briel for many, many years. This was a good location because it has ample parking. It's very reasonably priced. And there's a lot of exposure. A lot of people come through that area. Plus, I've tried to do this one time before. I was at First Financial Bank. I am trying to bring providers, or at least some professionals that are allowed into the downtown area. I have probably 500 or 600 people per month that come to my office from different areas, some of which have never been acquainted to Middletown. We've referred them to Swire. They've gone to different other places, restaurants. And so I feel like I'm in a good spot. My wife graduated from Middletown High School, and they had their 50th class reunion there. And of course, everybody wanted to come right into the office and take a look at it. So it's good exposure for me, lots of parking. It's convenient for people that are coming from Trenton, from Monroe, Middletown. It's just a good location. And it's away from the other chiropractors. There's nobody downtown here. So the people that are in Madison Township, of course, are really excited because now that the bridge is open, it's easy for them to just come across the bridge. So it just seemed like a really appropriate area for me to go.
Well, for the record, you and I have never formally been introduced. We've never met again.
No, we have not.
But I am familiar with you. You're a good, upstanding citizen. I'm just curious, have you ever had the benefit of seeing what the city plan is? In other words, all of the zoning for the downtown area?
You know, when I was at 15 months at Quantico Marine Base, and when I came back, I just assumed that, just like every other office that I've rented, that I would find office space and rent the office space. And then I found out that there was a fee for the zoning, and so I learned a little bit about it. I was not acquainted with that because I've always been on Briel Boulevard. That's never been a problem. You lease an office, boom, you're good.
So you haven't actually had that opportunity?
No.
Okay.
No.
Thank you, sir.
You're welcome.
I do have a question.
Sure.
Since you treat animals and people as well, what is your ratio as far as what's your percentage of patients?
There's probably more people since I've practiced here for 36 years with people. I'd say in a given day, it may be 3/4 of them are people. I do a lot of outside of the office because the residency program teaches you treatment of horses. I treat cattle, I treat pigs, I treat goats. And so a lot of that is in farms in the area here, all the way from, I cover from Alexandria, Kentucky to Columbus, to Wilmington to Eaton. So in my office, it's primarily people.
I think we're more familiar with chiropractic in terms of humans being.
Sure. Yeah.
I had to do a little homework in preparation on the animals
Yeah,
side.
1989, the American Veterinary Chiropractic Association became available. There was one school, now there are 4 schools. I went to the school that's in Kansas City. It's run by chiropractors. It's considered a chiropractic program, but they allow veterinarians to come to the program also. The majority of the people that come are from the chiropractic arena. There's 2 schools in Texas and there's one in Wisconsin, but the one that's in Kansas City is the one that is where it all started.
So when we're thinking, could you specify when you say animals, because it's broadly stated within the application, that you'll be treating animals, as you envision perhaps providing this service in this location, what types of animals are we?
So there's just dogs and cats that come into the office. If you looked at what I treated today, I treated a golden retriever with hip dysplasia. Most of these are referred by veterinarians who the people just don't want to. See, the whole reason of doing this for me is that people used to come in years ago and they'd be so sad because they had the choice of a $7,000 surgery or put their animal down. They couldn't afford it, so they put the animal down. So I thought that there needed to be an option for people, and so it was exciting to me to be able to offer that to people. So some of the conditions like hip dysplasia, animals do crazy things just like we do. And so they have a spine, it's just a little different. Horses do crazy things, all of those animals. So it's just nice to be able to study the differences. Obviously, a horse has more vertebrae than we do, so you have to understand all that. But the treatment is basically the same, it's hands-on.
So the location coming out of West Middletown into Middletown and knowing that there are horses and cattle and other things out in West Middletown, is your intention at some point, if someone were to call you and say, I need you to treat my horse, we're not asking you to bring a horse into Middletown.
No, of course not. You couldn't do that anyways. They wouldn't want to do that.
So in this case, but you're narrowing this to say that your intent would be primarily dogs and cats.
All right,
or to treat.
and people.
Okay.
Yep.
I got a couple,
Sure.
really easy. Do you view chiropractic as a complementary and alternative medicine?
I would think that that's what chiropractic is. It's an adjunctive. I work with a lot of orthopedic surgeons in town here. A lot of people don't want to have surgery, so a person comes in with a disc problem. They want to see if there's something conservative that can be done. In the event that we don't get success, then we usually refer them to a neurosurgeon or orthopedic doctor.
Okay, in your practice, do you examine, diagnose, and assume responsibility for the care of patients?
Yes, sir. That's what the state board requires that.
One last question, an easy one. Can chiropractors do high school sports physicals?
Yes, we are allowed to, and also give handicaps things also, certificates.
That's all I got.
Doctor, let me ask you, you would agree that what you do in the spectrum of medical treatment is within that spectrum, would you not?
It's not considered medical at all, though. In fact, even when you go to chiropractic school, medical is not mentioned at all.
Well, I'm having a
Anatomy and physiology you're studying neuroanatomy, you're studying all the necessary things that a person who would be in medical school study, but then we learn the manipulative things
and nutritional things, exercises and things that will help that person. So it's really not medical. It's not even ever mentioned. You know, if you look at the definition of Ohio, it's not medical, it's not mentioned.
What you just described is a doctor of osteopathic medicine, isn't it?
Well, but without the medicine, yeah. They kind of blew it because in 1968, the American Medical Association went into California and made all osteopathics medical doctors. And since then, they kind of lost that manipulative portion of it and became basically family practice.
But that was the origin of osteopathic medicine, was holistic versus
Right, yeah, it was
versus
Andrew Still as opposed to D.D.
medication,
Palmer.
other interventions.
And it was at the same time. They both were at the same time. I don't know if they ever communicated, but one was nerve and the other was more blood supply, increasing blood supply. So,
You said you're a cash-only business?
yeah, I always used to do insurance, but you know, copays have really gone crazy. For a chiropractor, being that it's considered a specialist, it's $50 to $70.
Okay.
And it's just difficult for people to afford that, so.
So no workers' compensation?
Nope.
Any type of
Nope.
insurance reimbursement practice?
I don't, nope. I used to do that. I don't anymore.
And I don't, you mentioned, well, you didn't mention, but on your behalf, Jeff Payne mentioned that your service is more akin to a personal service establishment as defined in 120409. I don't have that definition, and if I do, I couldn't find it as quickly as I should with.
Like I
What-
said,
what is-
I
what's-
really
what-
feel like
What's a
if you,
personal service
I
establishment defined? Do you know?
have no idea.
Okay.
All I'm
right.
thinking of is that you have a massage therapist. If you have a category for that, I think you could just lump chiropractic because we both work our hands and neither one of us use medication.
That's all. Thanks.
Regarding licensure for being a chiropractic practitioner, is that considered a medical use?
Nope, it's all chiropractic coursework that is related to that. Some of it is MRI evaluation, some of it is exercise, some of it is specific to different techniques like extremity adjusting. You have 36 hours every 2 years that you have to do for that.
Any other questions, Jerry?
How long have you been currently operating there? I understand you started operating before, were you operating before
May
the
7th,
application
May
for
7th I opened up down in Middletown, downtown.
2022?
Right, May, yeah.
Oh.
Yeah, I got back from the Marine base, I think it was in September, and then I just kind of got everything together.
That's all I have. Thanks.
Okay?
No other questions for Mr. McClure? No? Thank you.
Thank you, appreciate it.
Anyone else wishing to speak in favor, please come forward.
Sir, raise your right hand. Do you solemnly swear that the testimony you're about to give before this board, the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Identify yourself, please, sir.
My name's Jeff Payne. I'm the Executive Director for Downtown Middletown, Inc. My office is located at 1050 Central Avenue, Suite 2750. If you would permit me, I'd like to read my letter into the record, and then I have some additional comments I'd like to make after that.
Yes.
Okay. It's to the Middletown Board of Zoning Appeals from Jeff Payne, case number 1622, Dr. Mark McClure, 2 South Main Street. Members of the Middletown Zoning Appeals, Board of Zoning Appeals, I'm the Executive Director for Downtown Middletown, Inc. We are a certified Main Street organization. In that capacity, our organization seeks to advocate for the revitalization of the downtown Middletown community. Our mission is to build a vibrant community, unify downtown's businesses and organization, improve downtown's image and appearance, leverage historical preservation, develop a strong economic base. DMI wishes to speak in favor of this application, appealing the zoning code administrator's determination that an office for a human and animal chiropractor is considered a medical office and a veterinarian office and/or animal grooming, and is thus not prohibited in the UCC zoning district. We believe that Dr. McClure's use is unique in that it does not fit what some would consider the traditional medical office use. If we were to look pragmatically at medical office use, you may find such things as payment of insurance, issuance of medications like injections, shots, vaccinations, etc., issuance of prescriptions to be filled on-site or at a pharmacy, minor surgeries and casting of broken bones, patient counseling for mental health or drug addiction. Dr. McClure's operation is more akin to personal service establishments as defined in Chapter 1204.09, Subpart D, 15, and we did provide attached as that for you in Attachment 1. Dr. McClure has shared with me that his operation is constrained by law, that in order to operate, it needs to be drug-free. By law, he is not allowed to prescribe oral or injectables or perform surgery or surgeries. Treatment is hand-on manipulation of articulating segments to include removal on nerve, invertebral, subluxations, thank you. When we were sitting down, I was like, what? Can you spell that? Okay. He uses the same program for animals as for humans. I Googled chiropractor, the chiropractor defined, and it stated, a practitioner of a system of medicine, of interactive medicine based on the diagnosis and manipulative treatment of misalignment of joints. And I thought manipulative treatment of misalignment of joints was kind of key to me. I believe that there is a common sense approach. I believe that a common sense approach should be taken to assess this application. In Chapter 1230, definitions of the Development Code, and that's on page 254 specifically. Now, I got this off of the website. We find the definition of medical, dental / offices and 24 urgent care, and that's on page 257, and I provided that as an attachment. We find the definition of personal service establishments, and that's on attachment 3. If you read and compare these definitions in relation to how Dr. McClure operates his facility and presuppose the intent of the zoning regulations, it would appear to me that Dr. McClure's, and I had to rush to do this, his facility does not fit the characteristics of medical as commonly understood and is more closely aligned to personal services. As a final note, I feel it necessary to point out that according to Chapter 1226.01, subsection F, subsection 2F, the Development Code Administrator can review and make decisions on questions of interpretation that relate to this code, and based upon an initial discussion with the code administrator and the property owner and that should be July, because we did have a meeting, and I'll speak to that, he properly interpreted the use as personal service. In the personal service definition phrase, you may want you to also note that it says may include but not be limited to. This allows for the flexibility to place non-specifically listed uses in districts where they can operate and not be incompatible with the surrounding uses. DMI urges you to find that Dr. McClure use is more akin to personal service establishment and thus considered a permitted use in the UCC district. What I'd like to speak to is, first of all, veterinarian and medical. Downtown Middletown, Inc., we are very adamant about promoting our businesses in a positive light. We were made aware of Dr. McClure's establishment moving into the district. And one of the things that we wanted to do, because this is a way to help promote downtown, is to have what we call a ribbon cutting. And with the ribbon cutting, that's where we bring everybody in, tell all the other businesses, do the ribbon cutting, and then hopefully what will happen is other businesses, because they've been invited and they know about it, they will tell their customers, hey, if you have this need, here's a business in the downtown. So that's our promotional effort. So in July, the property owner of the Windermere, which is where this facility is located, we met with the zoning, I call him the zoning administrator. That's kind of where the background I come out of. And so we went through, kind of walked through what the use was and explained these aspects. And so I basically came away with the understanding that this would be something that would be more akin to a personal service use, simply because it does not fit those traditional thought patterns or characteristics of what medical office use is. And so that's why Mika was directed to put together an application, submit the application, and then we went ahead and scheduled the ribbon cutting, thinking that everything was in place. So I was a little surprised when we later found out that this was not being approved. So that's fine. I think there's a broader context here, and it basically is this issue of our code really does not go into and detail out the medical use bucket. So everything is kind of thrown in, and it's kind of easy for you to pick and choose. One of the reasons why in 2021 the city pulled the medical use bucket completely out of the UCC district was because of the concentration of mental health and drug addiction related uses in the downtown. And so, in fact, in February, and you're right, February of this year, I appeared before you adamantly opposing what was it called, zoning variance, whatever thing. Zoning use variance for an applicant. And I was here primarily because the code right now just does not properly allow itself to permit uses like your traditional medical uses to be established. And long term, this is going to be a hindrance to our downtown. So that's really something that you might want to suggest to the staff that they begin to look at. So we can go through, create a real list of definitions and ferret out those uses that you find somewhat objectionable that are medically related, and then keep in those uses that you find are more compatible with the long-term vision for downtown. And so I just wanted to make sure I put that information out there to you. And I was just wondering if, James, can you show that slide that has this appeal criteria? It was kind of like.
I think I passed it.
Yeah, I don't know if you passed it or not.
Right there.
Yeah, that's it.
Okay. So I know that what we're really looking at is this interpretation. And I think that the interpretation that we initially heard when we met with the zoning code administrator was that from a common sense standpoint, this is a use. It is not going to be, it's not going to bring any kind of traffic that would be objectionable and non-supportive of the vision of downtown. And in fact, it just didn't even seem to really be a medical use, because it could be like massage therapy or whatever those things are. And when I was looking at the personal services definition, which is like page 257 and part of that attachment, I started reading through it and saying, well, how can I convey this to you? But the real point of it is that in that second paragraph, it says, personal services may include, but not be limited to. And then you just create this list, this laundry list of things that seem to make sense. And so there is that, the code does allow for some objective judgment that says, okay, this isn't quite a duck, it's not quite a squirrel, it's something in between, and I think that this could work here. And so there is that flexibility that's allowed. And so I know we have challenges developing our downtown, but I think this is a use that I think would be of value to our community, not only short-term, but long-term as well. Thank you.
Thank you. Okay. Anyone else wishing to speak in favor?
Ma'am, do you solemnly swear that the testimony you're about to give before this board will be the truth, the whole truth, and nothing but the truth, so help you God?
I do. Hi.
Hi.
My name is Mika Glazer Jones, and I am the owner of the Windermere, the building where Dr. McClure has his office. And I come here before you today. You've heard a lot of the same thing. I'm not going to keep repeating all the same thing that both Dr. McClure and Jeff have said, because it's all the same stuff I would say. I've been a patient of chiropractic, not Dr. McClure's, but other chiropractors ever since high school. They do wonders without needing to be medicated, without needing surgery. And the amount of, and it is kind of funny when he brought in the fact that he does work on animals. And yes, he only brings dogs and cats in my building. No horses, no cows are allowed in the building. And in our building, he has a separate entrance that goes into his office space. So he's not coming into my main hall where I have weddings and such of that. But he does offer a great service to humans and animals. I see the dogs coming in, and sometimes it's a 2-for-1, the owners with their pets coming in at the same time getting adjustments. But there's no medical equipment in there. There's just tables. He comes in, adjusts them, they leave. It's very quick and easy, and he is constant from the moment he opens to the moment he closes. And he does do a lot of off-site for the big guys traveling around to county fairs and all that. But I think his business is a great contribution to our downtown. He brings a lot of people into the downtown area, and more professional businesses like this in our downtown would be great addition. So I think kind of opening that up, and like I said, it is very similar to massage, because most of the time when I go to a chiropractor, it's suggested I see a massage therapist first to help loosen things up so they're able to do their manipulations better. So anybody have any questions for me? That's all I got. No? Cool. All right, thank you.
Thank you. Okay, anyone wishing to oppose, please come forward. Anyone wishing to speak in opposition, please come forward. Okay, seeing no one, I will now close the public hearing. And we can move to deliberation.
Can I ask Mr. Metz a question?
Absolutely.
Make sure that I understand this. A massage therapist is an allowed, permitted use in the UCC as long as the therapist is licensed? Personal service establishment?
Check the development code real quick.
I might be able to help with that. And it may be helpful. I do have the definition of personal service establishments. If you'd like, I'd be happy to read that for you real quick.
Well, is that in 1204.09?
There's a definition section in chapter 1230 of the code. I don't know whether you have it or not.
It's in your staff report.
Yeah, I've got it.
That definition does not include massage therapists. There is, under the use-specific standards for personal service establishments, and that is 120409. It does reference in that category massage therapists as long as they're licensed, they are permitted as a personal service establishment.
So even though it's excluded or not included in the definition, the code has included a massage therapist
Yes.
as a personal service establishment
That's right.
permissible within the UCC.
As a professional service establishment, correct. Yep.
There's also, I think, an addendum that requires a massage therapist to be licensed through the City of Middletown's Police Department. So there's an extra step they have to do as well.
Well, I guess yeah, I understand that, but chiropractors and, I don't know about chiropractors in the city of Middletown outside of the UCC, whether they need to be registered with the city of Middletown. And I understand why massage therapists are probably registered with the city of Middletown. It's not because of, it's for nefarious reasons and not because of regulatory reasons. But chiropractors probably are not required to be licensed or registered through the city of Middletown Police Department,
That is correct. They're
Not that I'm aware of.
that I'm aware of. I wouldn't imagine. Okay.
I got a question too.
Okay.
Now, maybe this is to the doctor, but I'll ask you, Chief. Was there any discussion as far as equipment he has, such as x-ray equipment or manipulative equipment? I've been in a chiropractor's office too, and I know they did have some of that type of stuff. Does that come into play in this definition?
That's not a conversation that I had with the applicant.
They have the X-ray equipment, or refer them on to Adrian.
Thank you.
I was wondering if you could pull I think your reference that went back to 2021, it was the city ordinance, if you could pull that slide back again.
This one or the one before that?
May have been the one before. Yeah. So this is the one that lays out the prohibition on medical, dental. Okay.
So that's the stay. Is that what you're looking for, is the stay?
Well, I think what I'm asking is the intent, I believe, when this was passed by the city, and this may kind of go along with Mr. Payne's comments, that the intent probably was to make certain that certain things were not within the UCC district. And you lay out a whole series of those things on the slide. And the intent, I think, was to make certain that as you try to redevelop Middletown, that you prohibit these types of practices within the downtown. And I think the challenge that I have is if we look at the language, just the plain language of what would be considered a veterinary service. I think you're in an awkward position, James, because you have to kind of interpret in a way how to apply the prohibition or how to apply this. But I think when we look at, he's clearly not a vet. The service is clearly not a veterinary service. And in terms of it being a medical practice, can we say that he's actually providing a medical practice? And if we can't, that's where I'm interested in the comments from the board. It's an unusual case, frankly, because we haven't really dealt with this particular. I didn't know that you could manipulate dogs and cats in that way. I had to do some homework on it. Yeah, that's a new one for me. So now fish really blows my mind. I have to really think about that.
Mr. Moore, there is one definition that I think is helpful for that,
Okay.
which is that there is a definition in your definition section for animal care.
Okay.
The use category that includes kennels, vets, and grooming facilities all fit under that bigger bucket. And that definition is the animal care use category is comprised of uses characterized by the caring, grooming, and treatment of animals, including vet services.
Right, but he's not providing any of those. It doesn't even fit the definition of those.
That's for this board to decide. I think Mr. Metz decided that manipulation is care. It may not be medical care, but it is care. And all animal care facilities are excluded in the both UC districts, the UCC and UCS. And that's not a new change. That was not part of the text amendments.
So we're in the same trick bag Mr. Metz was in.
You have to decide whether he got it right. And that's why I say there are two. I think there are two, and it's up to this board. Maybe you'll call them the same thing, but I think there are two potential uses here, at least as staff analyzed it, for you to decide whether he got it right or wrong.
Close to the proximity of the downtown, I'm not sure what this would fall in, but if we look down South Main, not directly in I'm not sure if it's even part of the UCC, but there's a urology office located pretty close. I don't know if it's still a practice.
No, it's not.
But it's, okay. But I know that there was some medical That has long standing. It may have been code changes. I'm not as familiar with that particular use there, but we have funeral homes and some other things as we go forward. Eye doctors, those sorts of things, but,
Here's my concern, is that we've heard the description by Dr. McClure of what he does. It's strictly manipulation, joint manipulation, muscular manipulation, whatever hands allow to be manipulated. And my problem is distinguishing that between a massage therapist who's entitled to be there if licensed. I have a friend, name will go unmentioned, but I have a friend who's a massage therapist, and their purpose is to alleviate muscle strain, muscle pain, other primarily muscular, whereas Dr. McClure is obviously working on the joint system as well, vertebrae and other joints. That's where we've allowed massage therapists who performs basically the same, and unfortunately massage therapist comes with a negative connotation, but massage therapist who performs basically the same function as a chiropractor, maybe not to the extent a chiropractor does, but on the bottom end, shouldn't say bottom end, but on the bottom end of physical therapy, they're doing the same thing. And that's where I now have, I've looked at this, I've tried to look up definitions of medical treatment, but boy, when I see that Middletown permits massage therapists, now I'm befuddled.
I got a question for Mr. Metz. It's probably in here, we didn't see it. Would physical therapy offices be allowed in UCC?
They would not.
So physical therapy is akin to chiropractic.
But let me ask Mr. Metz the follow-up question. They wouldn't be allowed because why? Would it be considered a medical facility versus
They would be considered
massage therapist?
they'd be considered a medical office.
Medical, even though, as with a chiropractor, there's no use of medication, there's no surgeries, there's nothing but, anybody that's gone through physical therapy knows, there's nothing but the manipulation of the body. True? Okay. But that would be an interpretation that you would need to be making if an application for a physical therapy office was applied for here and down in the UCC.
Correct. And that would be the same process. I would
Same process.
I would consult the development committee, I would consult the
And
different
the legal department.
legal department, all the other different departments, and get a consensus and come with an answer.
I got a question for Dr. McClure. With physical therapy, can chiropractors refer or prescribe physical therapy to one of their patients to send them out?
Yes, just like an orthopedic surgeon can.
And,
Do manipulation, though. That's not
Right.
what the practice for
Right.
manipulation. And so a lot of times the physical therapy done secondarily after structurally the body is ready to do something to increase strength and endurance within the muscles, we work hand in hand with them, as do orthopedic doctors.
on my occasions to go to chiropractors, they did do physical therapy within the office. Some chiropractors do, maybe not as extensive, but they have the equipment, TENS units and stuff, electrostimulation and stuff.
Oh, only what is appropriate for our practice.
Right.
What's
But
surgical, yeah.
chiropractic and physical therapy have a lot of overlap in their,
Yeah, it's actually called physiotherapy and chiropractic. We're not
Yeah.
allowed to use the term
okay, I understand that. Okay, so you do overlap.
physical therapist. Yeah. Well, yeah, they work primarily with range of motion, with muscle work. You would probably say that a massage therapist and a physical therapist are closer than a chiropractor is to a physical therapist.
I have a question about the variance itself. If I know here we're saying a use variance. Are we able to apply a conditional use variance?
You-
We'd
This is an appeal.
Yeah,
So this is an appeal to the Development Code administrators. So it's my decision is, well, I'm not technically the Development Code administrator. It's kind of a loose term. I'm just the city planner, but it's a overturn of the decision to deny their permit, whereas a use variance would be to permit a medical office in downtown. So essentially, I think the biggest difference, and Austin would probably be able to elaborate on this a little bit more, a use variance is saying, yes, I understand that chiropractic work is a medical office, but we're going to apply for a use variance to allow us to be in downtown, whereas what the applicant is saying is, Mr. Metz, you have it wrong. A chiropractor is not a medical office, therefore we should be considered a personal service establishment, and therefore we should be allowed to be in downtown. So it's kind of a minute difference. Austin, is that correct?
yeah, that's the right distinction. I mean, one potential outcome of this, if you were to turn it down, would be that Mr. McClure could apply for a use variance. There's nothing that would prevent that. If you overturn Mr. Metz's decision, then he doesn't need to do that. His permit will be processed, and off we go.
When was the application for Dr. McClure filed? Well, I guess since it's been filed, has the planning department been, and you may not be able to answer, been discussing this lapse by not including chiropractic offices in a prohibited or allowed or permissible use? Did you understand that? I kind of chopped that up.
I've not had any personal conversations about a new text amendment, and to the best of my knowledge, I'm not aware of any of our directors having that conversation.
What I can say is, these types of gaps, as you call them, or lapses, they're all the time. Otherwise you end up with a code that's 600 pages long and nobody can actually manage it. So there's always some level of discretion. I will say, out of curiosity, I searched a number of other zoning codes in the region, probably half dozen, and I only came across one that mentioned chiropractic care. The other 5 didn't have any mention of it at all. So I think it is a line, and I do think we're, to some extent, it's in a gray area between two definitions. And so I think
that's why we're here.
That's what your task is tonight, is to shed some light on what the response should be in that gray area. When staff gets an application for someone to open a chiropractic care office, is staff considering that to be a medical office, as they did in this case, or are they considering it to be a personal care facility, personal service establishment, which provides services involving the care of the person or person's possessions. Those are the two categories that we have available to us, and that's what you all have to decide.
I think Mr. Payne has a response.
Yeah, we are. Yeah.
I'm only going to respond in a broader sense. As I mentioned to you before, I think that
I get hearing aids in February. Down here to the microphone so the other people can hear you.
I'm only going to respond in the broad sense to the question. Approximately, I think, 2 meetings ago, we submitted, that's the Board of Directors for Downtown Middletown, did submit or send a letter to the city manager requesting that we entertain or have some discussion on how to address the medical uses issue. And part of the reason is because if you look at those desirable medical uses, think what they also come with: well-paid staff. They tend to create other additional activity that people are going and utilizing the eating facilities in the community and things like that. And so we did ask for that kind of conversation, and we were told, at least at this point in time, that they didn't want to entertain that. And so that's kind of why that could have been an opportunity to ferret that out. We don't know. There could be a major medical provider who might want to look at locating in the downtown area. If you look at some of the business models of these traditional medical facilities, some are going with large facilities, some are going with smaller ones. And we just want to make sure that our downtown can be considered an opportunity site for whomever might want to come down with a traditional medical facility. Now, the question is, how is that defined?
Now, sir,
Yeah,
I do not want to insult you,
please.
but surely in your position, you have seen the plan, the city plan, have you not?
Yes, I have, sir.
Thank you.
And that's part of what we're trying to implement. Thank you.
Thank you.
So I guess just one final response on that question, just to remind this board, that really is a planning commission and council decision of do we want to get more granular or do we not? If they don't, then you may have a physical therapist here sometime in the next few months who says, hey, I want to open in a UCC, and Mr. Metz turned me down. You may not, I don't know, but that's what you have is the code that's here, and that's what we have to make our decision on tonight.
Okay, I'd like to just summarize my thoughts here. I know this is nothing against Mr. Metz's decision or anything like that. All I know is the doctors I go to would never consider a chiropractor a medical physician. Therefore, I feel that I'm convinced that it is more in the personal services category than it would be a medical field. And that's my position on this thing at this point. I am convinced on the argument that was presented. You guys decide.
Yeah. Boy, my biggest quandary is the fact that if massage therapy was out of there, it might be a little more of a stretch to find that this was a personal services establishment, but when personal services establishments include massage therapists, boy, I'm not even sure why the planning commission would have included massage therapists in a UCC, but that's neither here nor there. It is there, and we can't question what the planning zoning or the planning commission has, or the city council has passed as being a personal service establishment as a massage therapist, and I'm kind of, I don't know how you don't equate a chiropractic practice with a massage therapist.
Mr. Metz, could you pull up the denial, the certificate of denial? So in that paragraph, the third paragraph down, it talks about medical offices and veterinary offices and animal grooming are not, this is language that you gave for the denial. Medical offices and veterinary offices. Animal grooming are not permitted within the UCC district. And then you go on to talk about, kind of procedurally, this use be permitted with a use variance. I think I'm in a similar situation with Mr. Cash. Is what I can say, I think, is that he's not providing a medical, I'm using this language in terms of whether I would agree with it being a medical office. I think the issue here is that if we're going to say that we can practice massage therapy, which certainly isn't the level of education or licensure that he would be providing in an area, that it would only be reasonable that we would have some provision for him to be able to practice in this location. He's not providing a medical service, nor is he providing a veterinary practice. If we look at the factors that we might associate with a medical facility, and there's a whole range of things that have been talked about, whether it's medications, prescriptions, surgical, on and on. I mean, the physical therapy raises some issues, but I think, are we being asked to decide or distinguish between one or two, or just an outright denial? Are we saying we would accept that you could practice as a chiropractor there? Or is the city asking us to also say something about,
So the staff interpreted this as two uses: chiropractic care on humans and chiropractic care on animals. The stuff that's happening on site, if he's providing that care elsewhere, using this as a office base, that's not really an issue. I think the question for this board is whether staff got that right. For me, the easiest way to interpret it is, did staff get it right that chiropractic care for humans should be considered medical office versus personal service establishment? And did staff get it right that chiropractic care for animals should be considered under the category of animal care as opposed to, I guess, personal service establishment? I haven't heard a specific category for that yet.
yeah, that one's a little tricky on that one, so.
Let's go back to definitions then. Because I've heard Google, and then I've heard other sources that I'm a little more familiar with. I mean, using anyway. And I'd like for us to discuss the definitions again. In other words, you're telling me that your staff analysis, these are the definitions that you were making your judgment on.
That is correct.
Okay. That's very relative, and I would ask my colleagues to please take note. I feel like you're in the trick bag, Mr. Metz, and I don't want you there because you don't belong there.
Yeah. If we procedurally, are we being asked to have two different motions, or we just come to consensus and pass this as one if there's consensus among the board?
I think if you can get consensus, you can do it as one. If you can't, then I think you can do it as two if we need to break it out.
Okay. Okay, so I'm gonna suggest something here. This goes kind of along the lines with Mr. Cash. In terms of whether we accept, I would say that I would believe that Mr. Metz, unfortunately, as a matter of circumstances in the code, I would say that you erred in saying that chiropractic services is a medical service. And then secondly, I don't see that the services being provided on animals. You would also have erred in determining that this is a veterinary type practice or a veterinary services. So I would say on both accounts that the application should be overturned, or the denial should be overturned.
I would make a decision myself on what the doctor said, that he viewed chiropractic as a complementary and alternative medicine. That's the word we're stuck on, is medicine.
He did say that.
He did say that.
So are you saying that you want to uphold the denial?
I do.
Okay, anyone else?
Because he gives sports physicals and okays kids for high school athletics.
I guess,
Is that a matter of health?
I guess the question, what's on the table right now? Did you move?
We haven't made any motions yet.
Well,
No, just discussion.
And even in our,
Go ahead, Jim.
even in our own code here, I asked the doctor, do you examine, diagnose, and assume responsibility for the care of patients? And he said yes. Medical office or clinic uses a concerned with the diagnosis, treatment, and care of human beings as related to medicine. There's that word again, medicine. So I've always thought the chiropractors was part of the medical field. You said that you know physicians that don't recognize them. I was referred to a chiropractor by an orthopedic surgeon. So your times have changed since 1968, 1973. So I think you did okay.
I would concur with Todd's assessment of what is presented here, that but for the fact that massage therapy, and boy, I've homed in right on but for the fact that massage therapists are permitted in the UCC, and the code is silent on the issue of chiropractic medicine, well, I'll call it chiropractic medicine, because across the board, it probably fits into the general definition of medicine. But is the office a medical office or a medical clinic? I think I would have to say that it is a personal service establishment in which massage therapy is permitted. I don't see any other alternative.
But then,
As far as the medical or the animals, I agree. It's not a I'd have to agree. It's not a veterinarian. If we're going to say what's good for the goose is good for the gander, I don't know if he entertains ganders, but you could carry one in. But if chiropractic is not medicine within the code's definition or within the gray area here apparently of the lack of the code definition, then it also applies to animals.
Yes, sir, Dan. Go ahead.
Oh, I get hung up on, the Ohio law says diagnose and responsibility for the care of patients. That puts it in the category of medical to me. And that's in the Ohio law.
I got a question for Mr. Cashin. How do you reconcile the fact that massage therapist is personal service, but then you go past chiropractor to physical therapist, and they're not in there?
I guess my response to that, Jim, is we don't have an application here for a physical therapist. We have an application by a chiropractor, and that's what's in front of us.
I don't know.
And so if we had another applicant here with a physical therapy denial, then we'd deal with that too. But and if a physical therapist was here with an application, I would feel the same thing. A physical therapist is not administering medical treatment. They're just not. In the general sense of the word, anything you do in fact, first aid, there's a distinction between first aid and medical treatment, but first aid is actually medical treatment. Right. There's just a differentiation between the two when you come to workers' compensation and OSHA and all of those governing bodies. But medical treatment is a very broad. If I massage his neck because he's got am I involved in medical treatment? Well, you could argue that I am, especially if I have some type of a certification. But what I've got is a chiropractor here, and I'm constrained by the code here, and when I see personal service establishments that allow massage therapists, I've hit a speed bump, a big speed bump.
But doesn't diagnosis answer that question you have? Doesn't that really push it in one direction?
Well, let me ask you, if you were to go to to go to a massage therapist, I've never been, but if I had, I would assume a certified licensed massage therapist would ask, the first thing that they would ask me is, where do you have pain? Where do I need to start? I mean, wouldn't they?
Yeah,
that's
you're
a
right.
diagnostic.
You're right.
That's
You're
a diagnostic test.
That's what he's talking about there. In schooling, we are told to diagnose.
Dr. McClure, would you like to come back? Yeah, please come back.
Let's clarify diagnosis. Diagnosis in chiropractic school is to be able to determine if the person's condition is something that can be handled by a chiropractor or somebody else. You have to do a diagnosis. Sure. I do orthopedic, neurological, physical examinations, which is part of my scope of my chiropractic practice, to determine what is going on. Sometimes somebody will come in and they have bilateral sciatic pain. That can be a chiropractic problem, but it also can be prostate cancer. So I have to be able to diagnose to know what I can do and what I'm not do. That is chiropractic. I do not have a doctor of chiropractic medicine degree. I have a doctor of chiropractic degree. They're two separate professions.
But then the Ohio law also, not just the word diagnose, and assume responsibility for the care of patients.
That's what I treat. I treat patients that have structural mechanical problems. That's the scope of my practice. It's the treatment of vertebral subluxations, which is a chiropractic term, and what is in the board, that's what I am allowed to do. I can't do anything else but treat vertebral subluxations.
That's your edges on medicine when you talk about diagnose and.
You have to
Care of-
diagnose. I have to be able, I mean,
I
that's
know,
part of my schooling.
I know.
That's not, there's no medical doctor, if you had 20 of them here, they would say that there's no difference in the diagnosis that they do is the same, but what I do is completely different. I have to be able to, by law, determine if this patient is really a chiropractic patient. Sometimes somebody will come in and I have to do a Georgia cerebral vascular test. If they get dizzy, that means they have occlusion in the artery. I have to refer them to somebody else. I cannot do manipulation. So I have to, by law, our law, diagnose what that person's condition is, and that's why we have codes. That's why we have manipulation codes.
And you still would use the term care of patients. You would consider that
I'm
person to be a
taking
patient.
care of them, so that would be care of a patient, sure.
Okay,
Yeah.
so you do take care of patients.
Well, yeah, I take care of
Okay.
patients when they
It's-
come in. A patient is somebody who has a problem, so.
It's as gray as can be, it really
It's a
is.
tough one.
You ask any real medical doctor in the area.
So any other comments? Mr. Hamburger, any comments before at some point, we're gonna have to ask for a motion?
I'll make this comment. We're not paid enough. And this is almost one I think should go before a judge. It's most unfortunate that the city council, and I'm not gonna badmouth them because God knows they've had their hands full. But it's unfortunate that when they issued their order back in May, they didn't do anything about it. And now it's expired, where they asked for a moratorium, 6-month moratorium.
That moratorium was last year. That
was it
it expired.
That's even worse then.
Well, the result of that was removing medical office from the UCC. A year ago, we wouldn't even be having this discussion because medical office was permitted in the UCC.
I understand and apologize for that particular aspect. It's going to be easy for me to vote no and send it to a judge if they want to take it, or vote yes, for all the reasons you've mentioned, because it's extremely unclear.
Yeah.
I'll make a motion then that the appeal be, well, that the developmental, what's your title, James?
I'm the city planner, but oftentimes in the development code it refers to the development code administrator. That's not specifically for me or Ashley or Deborah. It could be any of us or all of us or none of,
Well, you were the development code administrator when the appeal was, or the application was denied.
Correct. In this sense, yes.
I would move that the decision of the developmental, now I've already forgotten what it was, code administrator's decision denying the application be overruled.
I'll second.
That's for both uses, correct?
For both uses.
Okay. We'll go with that. Jim Hall,
No.
Todd Moore,
Yes.
Dan Ward,
Yes,
Jerry Heidenreich,
Yes.
David Cash,
Yes.
and Christopher Ambergy.
No.
All right, thank you very much, everyone. Okay, that moves us to our next case this evening. This case, number 1722, request by applicant David Combs for approval of an area and dimensional variance for the property located at 214 Heatherway Street. The property is zoned R3 medium density residential. The variance requested is for the replacement of an 8-foot tall fence where the material change negates the legal non-conforming status of the accessory structure.
In the future, can I read this?
Sorry, Mr.
No, I'm just so I have something to say that's not basically just repeat. So this is an area and dimensional variance, obviously very different than what we just saw, which was an appeal. So the area and dimensional variance is for the property located at 214 Heatherway. The property is zoned R3. It's from medium density residential. The variance requested is for the replacement of an 8-foot tall fence where a material change negates the legal non-conforming status of the accessory structure. 8-foot tall fence is kind of a blur of words. It's actually a 2-foot deck with a 6-foot tall fence that's on top of the deck. But by the way we measure it, it's a 3-foot grade on either side. So the property is zoned R3 medium density residential. The purpose of the R3 medium density residential district is to provide for moderate density single family residential uses in an urban setting which are served completely by public infrastructure adequate for the applicable density of development. So you see right here is the property, and I believe the deck's right about here. The Middletown Development Code, Chapter 1208.06, fences, walls, hedges, subsection F, subsection 2, states fences, walls, and hedges, fences and walls shall not exceed 6 feet in height in any side or rear yard within any residential district or in the O1 and O2 districts. Now what I'd like to do is I'd like to clarify. This fence is considered legal nonconforming. This fence and deck was installed prior to the development code stating a particular height for this fence. So any repair or alteration to this deck would, if it was a repair for a like and like material, so if they were going to put up, if they were to tear part of it down, or if it was to be damaged, they could put it back up similar to how it was. If those boards were to rot out, they could put new boards in and still maintain the legal nonconforming status. Any repair, replacement, or alteration which does not impact the legal nonconforming status of this fence would be permitted. Now, it's kind of confusing, and I can explain that if you guys have any questions on that. The reason this came to me, and is before you guys now, is they replaced their fence. It was a wooden fence, as kind of similar to what you see here around their backyard. Earlier this year, they got a permit for a white vinyl 6-foot tall fence. It was approved, and then they wanted to replace their deck as well. They wanted to maintain it in the same height, same fashion as this current one is. However, changing the fence from the height and size it is now, which is fine as it's legal nonconforming, but changing the material to a white vinyl would in fact negate the legal nonconforming status. Now, after I made that notice to them, they went through the proper process. I think they applied 2 months ago, and then last month I don't believe we had quorum, and now they're here before you. So per the Middletown Development Code, the requirement for legal notice for variance requests, meeting notice letters, or the proposed variance were sent to all property owners. I did receive a phone call, and in the staff packet that you have received, there in the submission was a letter from the neighbor stating that they are completely fine with this change in material. It is the neighbor who abuts to this property. So although it says no comments were received, that's no comments were received after the application, other than a phone call. The applicant called, or not the applicant, the neighbor called once again, letting me know that they were fine with it yesterday, and that they would not be able to make it here today. So per the Middletown Development Code, the purpose of a variance is to provide limited relief from the requirements of this code in cases where strict application of a particular requirement will create a practical difficulty or unnecessary hardship prohibiting the use of land in a manner otherwise allowed under this code. It is not intended that a variance be granted merely to remove inconveniences or financial burdens that the requirement of this code may impose on property owners in general. Variances are intended to address extraordinary, exceptional, or unique situations that were not caused by the applicant's act or omission. And then I'll read the area and dimensional variance review criteria. The following factors shall be considered and weighed by the Board of Zoning Appeals to determine practical difficulty. Whether special conditions and circumstances exist which are peculiar to the land or structure involved and which are not applicable generally to other lands or structures in the same zoning district. Examples of such special conditions or circumstances are exceptional irregularity, narrowness, shallowness, or steepness of the lot, or adjacency to non-conforming or inharmonious uses, structures, or conditions. Whether the property in question will yield a reasonable return, or whether there can be any beneficial use of the property without the variance. Whether the special conditions or circumstances are a direct result from the actions of the applicant, his or her agents, or prior property owners. Whether the variance is substantial and is the minimum necessary to make possible the reasonable use of land or structure. Whether the essential character of the neighborhood would be substantially altered, or whether adjoining properties would suffer substantial detriment as a result of the variance. Whether the variance would adversely affect the delivery of governmental services such as sewer, water, electric refuse pickup, or other vital services. Whether special conditions or circumstances exist as a result of actions of the owner. Whether the property owner's predicament can feasibly be obviated through some other method other than a variance. Whether the spirit and intent behind the code requirement would be observed and substantial justice be done by granting a variance. Whether the granting of a variance requested will confer on the applicant any special privilege that is denied by this regulation to other lands, structures, or buildings in the same district. B. No single factor listed above may control, and not all factors may be applicable in each case. Each case shall be determined on its own facts. For the appeals, any person or entity claiming to be injured or aggrieved by any final action, the Board of Zoning Appeals has the right to appeal the decision. The Court of Common Pleas as provided in the Ohio Revised Code chapters 2505 and 2506. One point of clarification, in last month's meeting, or not last month's, our last meeting that we held, it was asked that the Development Code Administrator follow up with the Law Department regarding any staff recommendation. And it was determined that staff at the time of the meeting would highlight specific review criteria that would be applicable, and that would be at the end of the public hearing, and that would be typically when Planning Commission or another board would have a recommendation. This time we don't do recommendations, but I will highlight review criteria that I think would be applicable. In the most obvious sense, there's a reason why we didn't do it in the appeals case. But for this variance case, we will.
Okay. Thank you, Mr. Metz. Any questions for Mr. Metz before we open the public hearing?
The applicant is here.
Okay.
Still here.
I guess I have one. So currently, if the applicant were to rebuild the deck and the fence in the identical materials that were used initially, nope, it would be permitted.
Correct. Any repair, replacement, or alteration would be permitted as long as it does not increase the status of nonconformity, but a material change does consist of that.
So a composite material in the identical colors and texture of this fence and deck would require a variance.
Yes. I think you guys are starting to see how tricky my job is.
That's all I have. Thank you.
Well, we'll go ahead and open the public hearing. Anyone wishing to speak in favor of the variance, please come forward.
Levity is always good sometimes. Sir, do you solemnly swear that the testimony you're about to give before this board will be the truth, the whole truth, and nothing but the truth, so help you God?
I do. Evening, gentlemen.
Good evening.
I'm Dave Combs. I own the property at 214 Hathaway. As you can see, I'm kind of at a dilemma here. We put a
vinyl fence up on the other side, not knowing that we were gonna have issues on the other side. If that was the case, I would have left it the way it was. But I've spent almost $6,000 on that fence, and now we want to go ahead and match it. And it would make the property look a lot better. We have a swimming pool, an in-ground pool in the back, and it would make the area look a whole lot nicer, and it would raise my property value a little bit. And we had put a drain in a few years ago that was cost us $7,000 because there was a water issue that we didn't know about when we bought the house. It actually flooded the pool, so I had to call an excavator guy, come in and put in a whole new drain, get a permit, run it all out, and I think he has the pictures.
It's included in the staff report
Yeah.
that was provided to the board members.
Yes, you guys probably have it.
We have.
And that would be very difficult to put a fence on that ground right there. So we were gonna just attempt to keep it the way it was, and the only thing we were gonna do was to change the material only. And it's not actually 8 foot, it's a 6-foot fence, and actually small, it goes from 13 to 18 inches. That's the difference in height. And the highest part is in the middle, and it goes, or the lowest part's in the middle, and it goes higher on each end to where the fence would be normal. And we had a, hot tub back there and all that stuff. I'm hoping that you guys could grant me a variance for this.
You did mention in the application that, that it seems like the property has some type of incline or a slope, looking at the,
Yes.
just,
It's a hill from all the way down. And we're towards the end of it. And each fence gets lower, 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 lower. And if we did have a fence on that side, the property on that side would just see right straight into the pool. And I thought that would be another safety issue for kids. Because they see a swimming pool in there, they're gonna want to get in. But it's cost me a whole lot of money if I can't do this.
Guess who just put a fence up?
Put a fence up,
Cost a lot of money.
yeah, more than I expected.
Always does.
any other questions for Mr. Combs? No? Well, thank you, sir.
Thank you.
Anyone else wishing to speak in favor of the variance, please come forward. Okay, anyone wishing to speak in opposition, please come forward. Okay, seeing none, we'll close the public hearing and move to deliberation.
I'd make a motion that the variance be approved based upon the review criteria. Well, no, wait a minute. Did staff want to, did I jump the gun here?
You can make the motion without asking staff for the review criteria if you feel confident, or if you'd like to, you can ask the review criteria that we.
I would move that the variance be granted and that the review criteria A5 and A9, Roman numerals, small Roman numerals, would allow for the granting of the variance.
I'll second it.
Okay. A motion and a second.
Question?
Yes, sir.
Mr. Metz, is there a question regarding the height of the fence?
When you say, is there a question regarding the height, could you elaborate a little bit more on that?
What's the maximum height of fence we can put in our residences?
Within the zoning district, not considering a legal non-conforming fence, 6 feet tall. That is based off of considered grade, which is 3 feet on either side of the fence, the average, and then you go from there. The reason this fence is before you is because the height issue, but that's because the change in material negates the legal non-conforming status. But yeah, so it'd be 6 feet, I believe, is the short answer.
I'd like to comment on his statement there. The fact that the topography allows it to, the topography drops off, the height should be allowed.
Well, I'm in total agreement.
I know you are.
I just want
I just
a
wanna
fact.
put in
I
there.
want a fact here in front of all of us, because normally, it's not just the material we're dealing with here, it's also the height of the fence.
Right, and the topography lends to that.
Yeah,
I understood the height was not gonna be changed. It was just gonna be the materials with new materials, same height, same configuration, same, pretty
he
much.
just stated the maximum height by code is 6
Sure.
feet. This is gonna be 8 feet.
But this is a non-conforming use. This
Yes,
was,
I understand.
this was allowable.
I understand
Okay,
totally.
We're
okay.
all in agreement.
Okay.
I want you folks to understand me totally.
Yeah, I
The
do.
normal course of business in our city is a 6-foot fence.
Yeah.
Because I would have loved to have had an 8-foot fence.
On the inside, it's 6 feet. On the outside, it's higher.
That's it. Okay.
And
Thank you.
yeah, that is something to consider, Jerry, is that when you measure from grade, which is 3 feet on either side. We don't have 3 feet on either side, we have 3 feet on one side. So, I mean, I don't know what the other side looks like, or the slope, if it's higher, if it's lower, or what.
I'd like to hear the city's recommendation. Evaluate.
Review criteria that we would highlight was exactly the same that Mr. Cash highlighted, which was number 5. Wait, wrong direction. Whether the essential character of the neighborhood would be substantially altered, or whether adjoining properties would suffer substantial detriment as a result of the variance. The essential character of the neighborhood would not be substantially altered. It's a replacement of a structure that has an accessory structure that has been there, that has been existing, is just upgrading the material to a nicer material that's a little bit better shape. And then we've also received multiple neighbors call and tell me that they were absolutely fine with this application. Additionally, number 9, whether the spirit or intent behind the code requirement would be observed and substantial justice done by granting a variance. Mr. Cash made a good point earlier when you mentioned, if it wasn't such a change in color and material, would the legal nonconforming use status of this accessory structure be negated? And it wouldn't. So it's just because it's a material change. If it was stayed with wood, it would be completely fine.
Okay, we have a motion, I'll second.
We have Mr. Hall seconding.
We're good to go.
And then, are you okay if I?
Yes, sir.
Okay. Chris Ambergy,
Yes.
David Cash,
Yes.
Jerry Heidenreich,
Yes.
Dan Ward.
Yes.
Todd Moore,
Yes.
and Jim Hall.
Yes.
I'll send you an outcome letter and a COZ.
You want to upgrade your property?
And one point of clarity, this is the last variance case for tonight. I know in your staff packets you have a 4th. Yesterday, they sent me an email asking to have their application held over until next month. Okay. You're the neighbors? No. Oh, okay, cool. Oh, okay.
This was a use variance at 21.
Oh, okay.
Okay.
Thank you. Have a great night. But the applicant withdrew his application and asked that it be held until next month, so that doesn't start the 60-day count
Okay.
for the review. So,
Okay. That brings us to case 1822. So I will let you read this one, James.
thank you. So tonight before us, we have a variance case. This is by applicant Joe Allen for approval of an area and dimensional variance for the property located at 4700 Central Avenue. The property is zoned, I believe it's R4 high-density residential. The request is to allow a second ground-mounted sign where non-residential signs in residential zoning districts only allow one ground-mounted sign per business. Okay, so it's actually zoned R3. So if you notice, this property is actually 2 different zoning districts. R4, which is where majority of the business is, and then R3 as well. Several different parcels. So the purpose of the R3 medium density residential district is to provide for moderate density single family residential uses in an urban setting which are served completely by public infrastructure adequate for the applicable density of development. The Middletown Development Code, Chapter 122008, permanent signs permitted in residential districts, states one permanent ground-mounted sign may be permitted on a lot containing a non-residential use in a residential zoning district, provided the sign meets the following requirements. The requirements are on the next page, and I can read through those. Here's a picture to the sign to the bottom left. Here is the subject property highlighted in orange. This is a sign that was approved at the same time the other sign application came through. And we were in a bit of an issue, and this is another application that came before us where we consulted the development committee and I consulted the law department. So this is 6, maybe 7 different parcels, but considered one business. This is a business, or I guess for all intents and purposes, it is a business that is separated on 2 different zoning districts as well. So the requirement of having a sign, only one ground-mounted sign for a non-residential use in a residential zoning district, would that be permitted? That was, there was some gray area. There's reasons why I could have went ahead and signed off on it right then and there. And there's also reasons why I was a little bit uncertain. Talked to the law department. They said if there's any type of uncertainty, have them come before the board. It reduces liability on my behalf. I'm telling you, it's a tough job. The Middletown Development Code, Chapter 122008, permanent signs permitted in in residential districts for non-residential uses, permits one ground-mounted sign may be permitted on a lot containing a non-residential use in a residential zoning district, provided the sign meets the following requirements. The sign shall be set back 5 feet from the public right-of-way and 10 feet from any adjacent lot lines. The maximum sign area shall be 40 square feet. No such sign or portion of the structure shall exceed 6 feet in height. The sign may only be illuminated through an external light source. The first sign that was approved here at the top left of the diagram on your right meets all those qualifications. The sign on the bottom left, where it's circled and there's an arrow, that sign would also, its identical sign, would also meet the same requirements. The fact is the area dimensional is, you're here to decide whether or not this property can have 2, because it is one non-residential use in a residential zoning district. That's kind of how we classified it, was one non-residential use in a residential zoning district. However, it's technically in 2 residential zoning districts. So it's a tricky situation. Per the Middletown Development Code, the requirement for legal notice for variance requests, meeting notice letters for the proposed variance were sent to all property owners contiguous and directly across the street or public right-of-way, and no comments were received. Per the Middletown Development Code, the purpose of a variance is to provide limited relief from the requirement of the code in cases where strict application of a particular requirement will create a practical difficulty or unnecessary hardship, prohibiting the use of a land in a manner otherwise allowed under this code. It is not intended that a variance be granted merely to remove inconveniences or financial burdens that the requirement of this code may impose to property owners in general. Variances are intended to address extraordinary, exceptional, or unique situations that were not caused by the applicant's act or omission. Would you like me to read the review criteria? No. Thank you. And that ends my staff report. The applicant is not here.
I've got a question. Because I'm reading the R3 permanent signs restriction states one permanent ground-mounted sign may be permitted on a lot containing a non-residential use in a residential zoning district. Does the code, and I didn't look to see if this, does the code address this particular situation where one owner would, I don't care whether it's a business use or not, one owner would own several lots and whether or not the restrictions extend to the owners, to the person who owns several lots?
So sometimes lots and parcels are interchangeable. I don't know the definitions of either, but for an example, if an individual living in a residential zoning district, such as this school, if a resident living in a residential zoning district, either R3 or R4, had 6 parcels or 7 parcels connected, all contiguous, and their house was on one or on multiple, the same accessory structure uses for like a shed or a pool or anything else like that would include, when we do calculations for backyard, would include all the different parcels which would be considered in their backyard. Now, when it comes to signs are a little bit different, but could still be considered an accessory to a primary use, which is the school. And possibly.
So the use would supersede the owner having several lots that would maybe be subject to different, well, each lot would be subject to setbacks and sideline backs and rear setbacks. I'm not making myself clear here. I'm trying to. So the occupant's use would dictate the zoning restrictions that apply regardless of the number of lots that are involved. It's the use by the owner. Okay.
So,
Signs.
for example, yeah, for signs. Well, so for, like, let's say that the school was wanting to be built today on the 6 different parcels. The setbacks, the accessory structures, all the other accessory structures accessory structures would still have to meet requirements, but it's all those parcels are combined. Now, the thing that's tricky about this is that it's 2 different zoning districts, and if you see in the development code, specifies per zoning district, and we're in kind of 2. So this was definitely a difficult one.
Question for you. When the applicant brought it in, what was the purpose of the signage? Was it just to advertise? Was it because of safety, because it's a school and maybe people didn't recognize it? Was there any reasoning given for the application?
So the applicant is Joe Allen from Joe Allen's Signs, and he went through the permitting process for the school. Now, the importance of the signs for the school district, as you notice, this is a school district, so there are school hours and there is the 25 mile per hour during school hours. Having the signs there would indicate that this is the school zone, this is the school. That was briefly mentioned. I didn't specify with the applicant why the school wanted those signs there, but easy recognition is a good one.
Is there an entrance? Is that a point of ingress and egress there to a parking lot where this sign would be proposed?
Not to my knowledge.
Okay, I didn't see any cut-throughs there.
It's just a corner.
Yeah, I didn't
Familiar
see
with
any
this.
cut-throughs, okay.
With the school, the whole thing.
An entrance and egress sign would be permitted, and that would not be counted as a ground-mounted sign. That would be counted as an entrance and exit sign, which is slightly different, and those would be permitted, all entrances and exits, if they would like.
I'd just like to mention that there is actually the school speed limit sign that I tell you, this sign would be beneficial because, hey, if you don't know it's there, you're past it. What was that?
That's exactly my point. You come down Marshall, you don't see
That's right.
anything, and you go right past an entrance there without even a notification.
You're absolutely right.
So I don't know why we're waiting.
Yeah. I was going to say, one of the concerns there, that I think that this would help with is definitely safety. And I've been past the school many times when there's a lot of traffic there and folks are going in a lot of different directions. So Well, we'll need a motion
I
and
move that we,
lay out the hardship criteria as well.
let Dave do that. You ready?
You making the motion?
No, I'm waiting on you now.
I don't want to make all the motions.
We're doing fine.
We're ready for you now, David.
Well, all right, I'll make a motion that the variance be granted. And I think that, actually, A4 might also apply, that the variance is substantial and is the minimum necessary to make possible the reasonable use of the land or structures, which is a school at this point, and 5, and number 9, subsection number 9 as well.
I'll second the motion.
Mr. Moore, would you like me to call the roll?
Yes, please.
Jim Hall,
Yes.
Todd Moore,
Yes.
Dan Ward,
Yes.
Jerry Heidenreich,
Yes.
David Cash,
Yes.
Chris Ambergy.
Yes.
Finally, we ended on this.
Well, that moves us to old or new business. Any old or new business?
Oh, yes.
Okay.
Forgive me, number one, I wasn't able to be here at the last meeting, or I wouldn't be doing this now. I did have the benefit of watching you, however, on YouTube.
Man, you got to get a life.
That's why, oh, you'd be surprised. I'll be an attorney before you know it. Learn a lot on YouTube if you're looking for that kind of thing. The discussion on city staff recommendation. I have a lot of respect for Jerry. He knows it, so I'm not going to worry about this. I do disagree. Their recommendation is not going to sway me, and what I know of you men, it's not going to sway you either. We are a board of appeals, so we already know the city's position when we come here, if you'll consider it. They've been denied, or they wouldn't be here. And so I guess the whole conversation just kind of threw me. I'm sitting there thinking, because I know you, you're not going to be unduly influenced by anything I say or anybody else. So I didn't see it as the big thing. I'm sorry that council had to leave, our council, city council had to leave, because I really have a question. The issue of liability. Well, if the city's not liable, gentlemen, who is? Us?
No,
Huh? Well, somebody's liable.
You got E&O insurance.
no, no. I'm not going to speak for the city as a city's lawyer, but we all have an immunity here as we act. The only problem you have, as you read in the newspaper, with the new Miami, St. Clair Township trustee, I believe St. Clair, when a member of the Board of Zoning Appeals has a pecuniary interest or some type of an interest in the outcome of a variance, yeah, we have a real problem. But
That's
as
all.
we act as citizens on this volunteer board, subject to the criteria that we have, we're
Well, I just wanted to present this because it's
we're
not like
immune, just as James is immune.
it's not like we have never voted against the city's recommendation. We most certainly have. And we haven't done it very often, which I think is appropriate historically, because I'll say it again, if we do not honor this code to the best of our ability, unless there's a consideration to a body that the code, and here we are again here tonight, it's never going to be perfect.
Well,
I'm not worried about the city's recommendations to me, because I'm going to make my own decision.
I think, I'll speak
Please.
for myself.
Please.
It's the gray areas. I'm not sure the use variances that we have come before us and the area and dimensional variances that come before us. I don't know the city has too much interest in the outcome. other than the code presumably doesn't permit it. And it's just whether we can find some, on an area dimension variance, whether we find a criteria to justify it that doesn't set a precedent for the entire zoning district. The use variances are a little different because you have to meet all the criteria. We would have had one this evening, which would have been a matter of discussion. But what you just were involved in here tonight is the appellate process that we don't normally get involved in, where you have a code which is silent on a particular use in an area where another use is prohibited, and now we're asked to analyze the definitions that the city has provided, the intent that we maybe can glean from the code, and determine whether or not the denial or of a variance or of a use is an appropriate or not.
Right.
And truthfully, that's pretty significant.
It's pretty deep.
It's significant because what we've done here is we've created a precedent, much more than in an area or dimensional variance or even a use variance. We've created a precedent now where ultimately what the city council will be doing is, if they find that this is something that needs to be addressed, it will be addressed through city council with an ordinance amendment that will include and then this is how the law evolves.
Sure.
Right.
That's how law evolves, because if you read the professional services exemption or establishment, it says to include but not limited to, because you can't include every use.
There, and as far as I'm concerned, and the failure was to not complete that sentence.
Well, but it's not really a failure if you look at the uses and you try to determine what is the overriding permissible purpose. And even there, I got into I could see where a fitness.
That's what I was thinking of.
The fitness or health facility is permissible. Well, what does that
YMCA
facility?
gym's
That
got
facility is going to
trainers.
utilize personal trainers.
Yeah.
And so, we're in a situation where what is the overall purpose that the code is trying to, and I know we're on the record here, but Mr. Payne made a very good point. The medical offices exemption was put there because primarily to try to cover all of the addiction services and mental health services that were trying to infuse themselves into the downtown, which is not a favorable environment for business if you're trying to resuscitate a downtown.
Truth.
Medical offices themselves, really, why not?
Sure.
Why not downtown?
Right. Yeah.
Because
We remember the Castell building.
because the code hasn't distinguished between medical offices, and I'm speaking on my own, not from the code, but from what Mr. Payne said, it rang true. Medical offices, unfortunately now, are included within the not preferred uses of addiction services, rehabilitation, mental health treatment services. We don't particularly, they're useful, but do they need to be where where we want to attract the East End, Trenton, and all of the people to come into town to use the restaurants and the other retailing services if they're going to be confronted? You've read in the newspaper recently that one of our councilmen, Rodney Munerspaw, has created a task force to try to address this because he's been told by several of the businesses downtown that their patrons have been accosted, have been approached, and I don't know whether it's true or not. People just don't like to have to confront certain other people that are disadvantaged. Anyway, I'm off of my...
Is there anything else?
No. but in these gray areas, I think that I think you're right. We have we're strong-willed enough to discern whether the staff recommendation is what we really think applies or not.
Yeah.
But in those real gray areas, it might sway somebody that's really right on that fence.
Well, I think in this last case that we were speaking of, first and foremost, my knowledge of medical terminology, you're correct.
Well,
Chiropractors really are
well,
in this medical.
I will tell you what lawyers call chiropractors, they call them, and this is not being.
You are on the record.
Chiropractors.
I'm just saying, you are on the record. Okay.
On the record.
I was going to say, maybe I should cut Chris off at this.
That's a term that should never be used because chiropractors serve, I've never had, knock on wood, but I know a number of people that swear by their chiropractor that the manipulation that's performed remedies their
Yes.
physical ills, their physical ills.
Tell me this.
Yeah.
But my final comment would be this. I'm trying to think of the big picture. I did sit back here one time on another group, as you guys know, a long time ago, and I keep thinking of what do we really want the downtown to be? It's hard to hold to these things, and we'll never turn the corner.
No, that's why we have a plan. That's why the development code administrator.
If we don't consider the big picture, and the big picture is the code. That's
Well, and you're on planning commission, aren't you?
Yes.
And that's what the planning commission's responsibility is. We're the appellate court, like Austin was saying.
Fine.
We're the appellate court. This is the first time we've had an appeal of a denial, right?
Since I've been here, yes.
And I think it's the first time since I've been on this board.
It has, for me too.
I don't think we've ever had an actual appeal from a denial. Maybe another route is taken, such as maybe a variance for a use variance versus an actual appeal of your decision or your office's decision.
Well, I just
It's
wanted,
interesting.
I just wanted to start this discussion so you could finish it, and
I move we adjourn.
Fruitful.
you've done well, Councilman.
Fruitful.
Well, all those in favor, is there a motion to adjourn?
I move we
I got one question
Oh.
I just thought of, old business.
Okay.
Whatever become of the swimming pool in the front yard on Pearl Street? Do you remember that?
Oh, mercy.
I believe it was denied, and we've sent out code enforcement to let the woman know that it needs to be removed. I have not revisited the property.
It's still there.
I'll make note of that, and I'll ask code enforcement to go back out there and help remedy that situation.
Let's move to adjourn.
Okay, yeah, all those in favor of adjournment, say aye. Aye. All opposed? Adjourned.
Mr. Metz?